So good morning everybody, happy Friday, a very warm welcome to Cheshire and Merseyside colleagues and beyond to this CPD event that's been hosted by CHAMPS. Really exciting topic around skills for system leadership, which is obviously very prevalent in our work zones. So can I just ask people on the call to silence your microphones, but feel free to keep your cameras on if the IT's up to it. And just by way of introduction, my name's Helen Bromley. I'm the Director of Public Health at Cheshire West and Chester Council. And my lead role in CHAMPS, I have two. One is around health protection and the other one is around workforce development. So I'm going to be hosting the session today and we'll be introducing the main speakers as we go through. So as I've said, if you can put your microphones on mute, but leave your camera on where you can, it's always good to see you. Please feel free to use the chat to make any comments or questions for the speakers, and we'll pick those up as we go along. And also, please feel free to get involved on social media. You've got the hashtag CM Systems Leadership there, so do feel free to share further. We are going to record the session so that can be shared with people who can't make it today, and also yourselves if you want to go refer back to it after the event. And I've asked that you put the questions in the chat. So just briefly, CHAMPS Connect and Learn, it's your CHAMPS, we are CHAMPS. Connect and Learn is our approach to delivering workshops and events that allow us to connect with each other, learn something and feel inspired. As I've said, it's CHAMPS organised on behalf of the 9 Directors of Public Health and the Director of Population Health who's based in the NHS, 10 of us partners in crime. We work together, as some of you will know, as a public health collaborative across the Cheshire and Mersey region. And we work with our system partners to improve health outcomes and tackle health inequalities. So that is at its core system leadership working as I see it. And you can find more about the CHAMPS Collective on our newsletter Collaborate, and the link is there for you if you want to sign up for it. It's really useful knowing what's going on across the patch. So just by way of introduction to the session, following the training needs assessment last year, we identified a gap around systems leadership. So this is a first step in introducing the concept and some core skills. And we hope to provide you with an understanding of the core concepts and some practical examples from our speakers from Cheshire and Merseyside. And then alongside the programme, there will be another programme of CPD events, which we will promote through the Collaborate newsletter. So as I've said, if you haven't signed up for it, do. The link is on the slides, and it's well worth getting. Drops into your inbox. It's dead easy. You don't have to do anything else, just read it. So just by way of the agenda today, we've got a couple of hours. It's going to be quite fast paced, I think, but really valuable information. So we are really lucky to have Debbie Sorkin with us. Debbie is the National Director of Systems Leadership at the Leadership Centre and has more than 20 years experience strengthening leadership in public services. We've also got Dr Ruth Hussey, who has, oh gosh, Ruth, you've been around and about, haven't you? So DPH in Liverpool, CMO in Wales, you had a regional role for a while, and it's lovely to see you here today as well. And then we'll have some talk from Esther as well, some information about working at a local level. Esther is based at Knowsley, and individuals, the speakers, will introduce themselves further as we go through the morning. So I'm just going to go back to the first session, which Debbie will lead. As I've said, Debbie's got a national directorship role around systems leading. She's worked for the Leadership Centre for the past 10 years, worked with NHS, local government, local authorities. Many of us already have worked with Debbie in the past. I'm absolutely delighted and very privileged to have Debbie here today, so thank you for sparing us the time, Debbie. Currently, she's working on an OHID systems leadership programme for public health professionals, so Debbie understands the public health world in detail, which is another added advantage for us. So without further ado, I'm going to hand over to Debbie to take us through the first session, which is working in complexity. So Debbie, the floor is yours.
Thank you very much, Helen, and thank you very much, everybody, for being here this morning. I appreciate how busy everyone is at the moment, so thank you very much for making the time. If I could have the next slide, please. Sorry, there is going to be quite a bit of that. As Helen says, I work a lot with public health professionals, both in public health roles and more broadly within and outside local government. I also work, because I noticed there are people here from a kind of sport and physical activity background. I do a lot of work with Sport England and active partnerships as well, so understand something of that world. And we thought it would be timely to first of all provide an overview on what it means to work in complexity, of which a bit more in a moment, and how this relates to what we're currently facing. Then to provide some pointers as to what you can actually do in these circumstances to navigate a way through, and I hope to persuade you that it's a lot. We are not powerless in these situations. And then after a break, look at how you can influence when you don't have direct positional or formal power. And again, I think you might have more power than you might imagine. In each session, there'll be a few slides. As you can see, they'll be quite pictorial, although there will be some content as well, and then it'll be back to you, and we will take as many questions as we can in the time, but we do commit to coming back to you if we can't answer the questions fully in the short time we've got. So, bit of context first of all, if I could have the next slide, please. Yes, this will be familiar to many of you. Huge amounts of upheaval in the system, one way or another. I won't just go through and read all these. You can read them for yourselves, but I have chosen them because I think they are likely, either directly or indirectly, to end up at the door of public health, or to end up at the door of people who are looking to encourage people, for example, to move more or to do something about well-being. So, for example, if we're looking at changes to integrated care systems and integrated care boards, we don't know what the consequences will be at the moment of what's planned, but there may well be an immediate implication that you may see in terms of people on the other side who you're trying to get to move to be unwilling to take action, as they might once have done. And the external environment, as we know, is not propitious. We see poverty in Cheshire and Merseyside. We see real health disparities and inequalities across the patch as well. And I don't think the current situation helps health and care or public health professionals who are caught up in this, at the same time as being seen as needing to hold the ring on dealing with health inequalities, doing something about population health, doing something about the proposed shift from, for example, sickness to prevention. So we have huge upheavals that are not happening in a steady state. And in these circumstances, it can be easy to retreat to what we know or think we know, or to revert, or just to sit tight, to kind of wait and see. But I want to suggest to you that there are things that we can do. Actually, we don't need just to sit and wait and see. There are things we can do to work across boundaries, to build relationships, to influence, and to effect change. Key thing is knowing where to start. So if we could have the next slide, please. So start by knowing what you're dealing with, so that you can use the right tools in the right situations. And some situations are going to be complex. There is the line, all models are wrong, but some are useful. I happen to think this is a particularly useful way of thinking about the world. I should say it's not my way, belongs to a man called Dave Snowden, who started out as an anthropologist, but now works in this space. And if any of you have children, Dave has a lovely, droll, deadpan video on YouTube about how you apply complexity to organising a children's birthday party, and it is well worth a watch. But his basic contention is that some things are simple, some things are complicated, and some things are complex. And the key thing is to know the difference, know what you're working with. Simple things, you do one thing and something else automatically, predictably follows. You have cause and effect. You go into a room, you switch the light switch on, the light 9 times out of 10 comes on. You know what to do if it doesn't. Some of what we deal with in our everyday lives is simple. A lot of what we do, a lot of the project work that we do, a lot of the professional work that we do is complicated. That means you don't just do one thing, you do a series of things based on your professional knowledge and expertise. But again, you know, if you follow the project plan, if you follow the protocols, if you follow the rules, you will get the outcome you're looking for. So back in the day, if you wanted to build a Nightingale Hub hospital, you called on Colonel Ashley Boreham here in the middle. He'd built field hospitals, knew what to do. What to do was difficult, but he knew if he followed the project plan, he would get the outcome that he sought. But some of the things you're dealing with at the moment, particularly through a public health lens, are neither simple nor complicated. They're complex. These are the issues that are more elusive, more somehow shape-shifting. They're deeper seated. They involve more people. And if I could have the next slide, please. It's my hypothesis that you are probably ticking every box for working in complexity for some of what you are involved with. Now, I happen to think that there is a public health and active partnership superpower in being able to deal with complexity. But watch for these kinds of issues. Whenever you're presented with an issue, look for these kinds of factors. Are you dealing with stuff that's been around for a long time? Lots of different things have been tried. There are a few obvious solutions. There isn't very much money to go around, not many levers to pull, and you can pull levers and they don't seem to be attached to anything. Are you having to herd lots of cats? Are you working in a political, large or small p, environment? Any of these things that apply, you are probably working with complexity. Should say not everything is complex. Sometimes people throw their hands up to about any problem and say, oh, we can't do anything, it's complex. No. Sometimes it's just complicated. Sometimes it's just difficult, but sometimes it's complex. And the key thing about complexity, about complex situations, is that you only know after the event what is going to happen. So just saying we're going to spend X amount of money on this is no guarantee that it is going to turn out as planned. You might get what you're looking for. You might get something that's just a bit meh. You might get something completely different, or you might get nothing at all. You will only know after the event. And by the way, when I say you, I mean you and everybody in your team, because complexity is no respecter of seniority. You can be absolutely on the front line and dealing with complex issues. And when you've got these kinds of issues, you need to work differently. Luckily, there have been ways of working developed for working in these circumstances, but they involve trying stuff out, basically, amplifying what works, seeing what doesn't, and stopping doing what doesn't. Sorry, I'll just shift that. Stopping doing what doesn't. We are often very good at starting new initiatives. We are less good at stopping them. And that can feel hugely countercultural if you're working in a local government environment or if you're working in an NHS environment. The NHS never met a plan it didn't like. So leadership in these situations is always about how you manage risk, how you mitigate risk, how you give people who are inherently working in uncertain conditions just enough clarity so that they can move on. If you do this, there is good news and bad news. So if we could have the next slide, please. So the good news is you will be dealing with reality. And I think that's always a good place to start from, honestly. Deal with reality. The bad news is that you will not be thanked for this, because people do not like complexity. It is inherently hard work. So the other thing, of course, is don't do it on your own and give yourselves a break. Okay, understand, this is hard. But not everyone is up for complexity. So you will get pushback. This is not going to be plain sailing. And you can get smoke blown in your eyes from all sorts of directions. I sometimes play pushback bingo, and I ask people how many of these things on the right they have seen. And quite a few people say, all of these really at one time or another. But watch for these things. Don't just file them under R for random. They're really not. They are people trying to avoid complexity and avoid the real work that goes with it. So watch for people doing the wrong thing busily. Let's have another meeting on this. No, let's not actually. You cannot meeting your way out of a complex situation. Taking refuge in governance. Now, I love governance. I'm a Ned. I love governance. But if you get in response to, can we try something new? That's really interesting. Could you tell me the terms of reference? Can we have a committee on that? That's really what I'm referring to. The other absolute dead pointer is obscure or vague language. You know, you're sitting in a meeting and it's acronym central, or you read something and it makes sense on the surface and then you read it again and you're not quite sure. Call it out if you can. Be very tactical about it. Go in a herd, all asked together, but absolutely call it out if you can, because if we're dealing with complexity, we need to be really clear what we mean by something and what other people mean by something as well. And it's worth noting that a lot of this is not necessarily to do with fear of change, but fear of loss. People don't necessarily fear change, but they do fear loss. And yes, absolutely, loss of job at the moment, absolutely. But as well as that, think about the stuff going on in people's heads, the perceived losses, things like loss of face, loss of control, or perceived control, loss of status, loss of identity, especially professional identity, loss of some stability, loss of familiarity, familiar ways of doing things, familiar colleagues. If you've ever wondered why people get umbilically linked to their desks when you're proposing something new, that can be why. And I hereby give you permission, all of you, I give you permission to go for a coffee with someone and do this before you propose something new, and think about the losses that might be going on in people's heads and allow for that. Couch your arguments and proposals in ways that show you're not necessarily going to change what you're suggesting, but you acknowledge the losses. You can save yourselves inordinate amount of time and worry. So, complexity, you are not going to know in advance how things are going to work out. Not everything is complex, but if things are complex, you need to deal with them accordingly, and you need to understand that it's easy to get distracted and not everybody will thank you for raising the topic. Now, we did want to make this as interactive as possible in the time, so if I could have the next slide, please. What I suggest is probably it's best for people to put stuff in the chat, unless you have something particularly burning that you want to say. But if you could put in the chat, what's resonating for us here? What am I seeing that's actually complex? That is about people working in a political environment or a politicised environment, one that's acutely attuned to changes in the political wind, deep-seated issues that have been around for a long time, no easy or obvious solutions, not many resources, lots of cat herding, lots of shape-shifting as well. And how does it play out? Are you seeing pushback at all? And Tracy, if we could stop sharing the slides for one moment, please. And then I just want to go back and have a look at the chat and see if we're getting anything in. So anything that's occurring to you about what's complex about what you're dealing with, right here, right now? And how does it play out? And what pushback do you see? Fantastic. Thank you, Helen, for starting it off. Yes, absolutely. All these things, not just on their own, but because complexity is about interconnection, all these things interplaying and layering on each other. Thank you, Hilary de Cock. Boiling down to lack of resource and then governance. If people unwilling to ask themselves what true governance is, what true assurance is, in these circumstances. I've got Guy here, thank you. I like the way you put transformation in inverted commas, Guy. Ongoing corporate transformation programme has not considered issues of loss. Yes, and the other thing to look for is incessant restructuring. Honestly, if you want to avoid complexity, have a restructure. Absolutely perfect cast down way of avoiding complexity. No one will talk about anything else for months on end. If you ever want to avoid it, absolutely have a restructure. Oh gosh, lots of stuff now. Thank you, Danny. Everything was saying, resonating. Yes, difficulties in embedding different ways of working within an NHS system that requires short-term impacts. Yeah, especially in a public health context, but also in a population health context. You will be looking to do things that take time, but at the same time, you can have the effect of almost like an NHS megaphone or a local authority megaphone in your ear, saying, can you give me this data now? You know, what can you show me instant impact? Whereas the impact might even be generational. NHS, Sarah Rogers, hi Sarah, NHS England changes, trying to break down data silos. Data silos not just on their own, but as a demonstrator of culture. Trying to change cultures is very, very hard, especially when they're embedded, especially where there is payoff for people. And we could do an entire session on that. Oh gosh, lots of stuff there. I'm not going to be able to get everything, sorry, but we will come back to everyone who raises a question on this. Tracy, Bethany, too much focus on process rather than what are we actually trying to do here. It's really interesting. If you've got a meeting about something and it purports to be about a particular issue, honestly, just check understanding in the room about what the problem actually is, because people come and they've all got their own idea of what the problem is, and it can be very different. It can be a real light bulb moment for some people when they realise the problem isn't what they thought it was. Really worth checking that. Alex Holt, sorry, I just missed you. Hard to navigate the change. Yes, yeah. Lots of stuff here. Thank you all very much indeed. After this morning, I think we will go back and look through the chat and see if we can pull out sort of key themes from it. But yes, well, congratulations. You are all in the right place because you are all dealing with complexity in one form or another. So I want to go on now to looking at what you can do instead. So Tracy, if I could have the slides back, please. Thank you very much. Fantastic. Fantastic. So if I could have the next slide, please. I want to convince you that you are not powerless in these situations. There are ways of working that will give you some room for manoeuvre, that will help you tip the scales in your favour when so much is outside your control. And it will help you think also about where you want to focus your energies. So if I could have the next slide, please. Thank you. First of all, this is not about being the leader, okay? This is not about seniority. It's not about grading. It is certainly not about banding. The organisation I work in is not called the Leader Centre. It's called the Leadership Centre. So this is about leadership. And the best definition of leadership that I've ever found is this one here on the left. It's from Marshall Gantz. Marshall Gantz, still around, is American, now in his 80s. He started out at Harvard in the mid-1960s as a student, and he left to join the civil rights movement. So he knows all about really difficult circumstances and people who don't want to change. And he has this lovely definition of leadership. It's about taking responsibility for enabling others to achieve shared purpose in the face of uncertainty. So it is absolutely about actions. It's about the behaviours that we choose to sign up to, the reciprocal behaviours, how we behave in a system. It's about relationships. It's about being in relation to others. It's open to everyone. What you do will differ according to where you are, but everyone can do something to strengthen their leadership actions. And it's about power, but power through purpose. Martin Luther King talked about power being the ability to achieve purpose. So this is about power, but it's also about how you influence other people. It takes uncertainty as a given. Hello, this is where we are, but also the possibility of change. So never see systems as things that are set in stone. Okay, they're not immutable. They can change. Quite often they change by the stories that people tell each other through the trusted relationships that they have, and thereby change the idea of what is possible and what's not possible in a system. So always see systems as having the potential for change. And also, if I could have the next slide, please, thank you. Do not have imposter syndrome about this, okay? You and your teams are absolutely the right people to be doing this work. So never get phased about this. And there are things that you can do. There are ways of working, sometimes called systems or adaptive leadership, that have been developed for exactly these situations. So if we could have the next slide, please. I put up the God of small things at the start here. And it's based on the idea that if you have the word transformation in your job title, or you're dealing with population health, or you're dealing with something that looks big, you feel you've got to do something big. I've got to do something big, and I've got to do something now, and it's all got to kind of sort itself out overnight. Systems leadership is different. It says, actually, you don't need to do anything big. You start with what you can do, with what is in your ability to control or to influence. And you start from where you are and you go where the energy is, and you let change build up over time. This can feel very mundane, it can feel very unglamorous, but it is absolutely how to work in these situations. And it is based on particularly the idea of relationships, and the idea of purpose, and the idea of reciprocal behaviours. If you have good relationships, I don't mean being best mates. I mean, if you've got the kind of relationship where you can disagree and still come back to the table, and you can build trust, you can thereby have the possibility of influence. So really think, and we'll come back to this after the break, about the people you want to influence and the amount of trust in the system at the moment, because this is not my line, but I think it's absolutely true. Systems move at the speed of trust. You allow for the unexpected. Okay, so much better to take a couple of steps. Do short-term planning. What do you want to happen in the next 30, 60, 90 days? Take a few steps and then see what your next move should be, rather than say, here is our plan and we're going to follow it. Just allow for what emerges. And think about this in terms of distributed leadership, so it's open to everyone. You can have networks with semi-permeable membranes, people coming in and out, rather than just relying on hierarchies or formal power dynamics. I'm not saying those don't exist, they absolutely do. But there are ways of working around them, and the ways you need to work around them when you've got a complex situation. So I want to talk about relationships a bit. I want to talk about shared purpose, and I want to talk about behaviours. So I'm going to start with relationships and why they matter. And if I could have the next slide, please. So people think this is somehow fluffy stuff. Or they're sometimes called soft skills. Marshall Gantz calls them higher order skills, and they really matter. They matter because this is the way that you can effect change. And I think particularly in a public health context and also in a sort of broader well-being context, this is absolutely crucial. It's a kind of superpower, and your power to convene people in order to influence is a power you shouldn't underestimate. But I wanted to use an example. It is not from Cheshire and Merseyside. It is nothing to do with public health, but just to show you the power of relationships in effecting change. So this was actually from last June. It was the D-Day 80 commemorations over in Normandy. This photo on the right, obviously, of David Lammy, now Foreign Secretary, meeting Volodymyr Zelensky. At the time, David Lammy was not Foreign Secretary. He was Shadow Foreign Secretary. If you're a shadow minister, leader of the opposition, you don't, by right, get to go to occasions like these. He should not have been there. But David Lammy had spent time building relationships before the event. So, you don't just start on the day. You certainly don't start in the meeting. He spent time beforehand developing relationship with the Macron administration in France, tweeting in French, writing articles, just building those relationships. And what happened was that the rules turned out to be not to be rules after all. They turned out to be conventions, and conventions can be broken. So when people say to you, oh, it's not possible, if you've got relationships, it is worth just testing out what is possible and what is not. You'll be surprised how much moves. So absolutely spending time developing relationships is real work when you're working in complexity. I always say it's more real work than being in the actual meetings, because not much gets decided in the meetings, but an awful lot can get decided if you're actually involved in building relationships. And once you've got the relationships, you can start to move towards shared purpose. If I could have the next slide, please. I bang on about this, as people will know, but it is because it is so important. It's absolutely the foundation of collaborative leadership. If you're looking to work in partnership with anyone, this is what you do. You don't start with governance. You don't start with structure and form. You start with purpose, which is not the same as a mission statement. It's not something you just write on a wall or stick in a document and then put in a drawer. It is working out with a few people who think the same way you do about an aspect of your work. The answer to 3 questions. What is it we want to do? Why do we want to do it? And the why is as important as the what, and very rarely gets asked, but it's as important as the what. And what are the benefits going to be for us, for our colleagues, for the people in our communities, for any other stakeholder you have? It is absolutely your foundation, because once you've got your shared purpose, you can make it supremely practical. You can think about what are the safe to fail experiments we want to use, who are the stakeholders we want to engage, what are the narratives we want to use, what are the indicators that would show progress here, where are the pressure points, so that if people say I can't do this, they're not being difficult, they just can't do it. And it is foundational because it keeps you going over the long haul, over changes to priorities, to people, to governments, to guidance, to anything. There will always be more change coming down the line. If you've got your shared purpose, sometimes you will have to feed the beast, but this is what can keep you going for the long haul. plain English, an aspect of what you do, absolutely give this a go and do this work first of all. And once you've got your shared purpose, just keep it to hand. You know, if there's a meeting coming up, is it helping with your shared purpose? A bit. If it isn't, can you tweak the agenda so that it is? If it really doesn't, do you need to be there? Because the biggest constraint at the moment, apart from money, is people's time. And people spend time in meetings, and it is really worth thinking about, what's my shared purpose? What's my purpose here? Is it helping? If you have a shared purpose, you can motor. If you don't have a shared purpose, you will end up just responding to everybody else's agenda. And especially in a public health context, I think that's a real risk. So think about, what's our shared purpose here? And just start by giving it a go. It is never too late to do this. And be explicit about behaviours. If we could have the next slide, please. Thank you. This is work by Nicola Burgess. She is really clear. Respectful behaviours are the foundations of any relationship, and you can make them explicit. And if they're explicit, then you can call them out. And if you don't call them out, people adopt the brace position. So they stop coming to meetings, they start worrying about what's going to happen. Absolutely be clear about this. And you, again, short, plain English. If I could have the next slide, please. This is an example, another part of the country. It's with their permission, Devon Primary Care Collaborative. They had real problems, they weren't alone, and they just came up with these rules. These are the rules of the house. We will have honest conversations, we will respect each other, we won't fall into rudeness, challenge but don't insult, don't just obstruct for the sake of it, and be genuine. Know that we all do this because we are coming from the same place. We all want good patient care. So this is a list on a page, and they used it and it changed what happened. So really worth thinking about behaviours. And if you work in these ways, if I could have the next slide, please. You can end up with some very different conversations and some very different outcomes. So I've put this up because it involves public health and physical activity. Calderdale Public Health wanted to do something about levels of physical activity among schoolgirls, particularly at secondary school level. They started out with a letter to parents and families saying we will offer aerobics and Zumba, because obviously that's what they wanted. And then they asked, who isn't in the room here? What do we need to do? And of course the schoolgirls weren't in the room. So they did a great thing. They invited them in. They trained the schoolgirls in research methods, and they got them to do the research. And they ended up not with aerobics and Zumba, but with taekwondo and boxercise, because that was what people wanted. And by an amazing quirk of fate, Helen at the start mentioned the OHID programme. One of the girls who was trained in the research methods is currently on the OHID programme. So it really sort of has resonance down the years. The key thing, if I could have the final slide in this section, please. Do something. Honestly, don't get defeated. Don't wait for others to change. Or wait for something to descend from on high. You could be waiting an awfully long time. There's a man called Myron Rogers, and he has these maxims which I think everyone should paste to the wall. So absolutely give people ownership. This is not a theoretical construct. It's about real work. Keep connecting the system to itself, keep making the connections, start anywhere, follow it everywhere, and do something different. Use adaptive leadership, do something different, because the process we use to get to the future determines the future we get. So I appreciate that has been a whistle-stop tour around what you can do, but I hope it gives you some ideas of that change is possible, that it is feasible. Just before I hand back to Helen, if I could have the next slide, please. Thank you. I just wanted to come back to you again, to stop sharing the slides and come back to the chat. What's resonating for you? What questions might you have? So if we could close the slides and I can come back to the chat. Is this resonating with you? So obviously a lot of things that are around complexity are resonating. Are you using some of these approaches already? Are there particularly questions that you have? Or have I just stunned everyone into silence? Give people a moment. Yes. Thank you. Yes. I chose to revisit how we work. Thank you, Hilary. Yes, please do. Just follow this. You don't need huge expertise. You don't need external consultants. It can be a way of working that is about applied working. It's about applied learning. Not just about information. It's about applying these ways of working. Do you have any tips on how to start these relationships in an online world? Thank you, Hannah. Really tricky. I would say don't start them in an online way. Go and have a coffee with someone. It is absolutely a good use of your time, because there is something about the online world that is not helpful for building relationships right from the start. There's a commentator called Ian Dunt, and he said that one of the things that the online world does is that it removes eye contact, because people are looking at their cameras rather than really looking at each other. So it makes a real difference if you can find time, not for everybody, but start with one person and start with going for a coffee with them, rather than starting from an online space. I appreciate it's difficult, but I really think that's a good use of your time. Lots of stuff in the chat. Where's it coming? Yes, a lot of this is common sense, but it rarely gets done. That's the thing. We get caught up in ways of working, particularly if they are about traditional cultures, and it can be very hard to stop. And you find people, when they come to talk about what's our shared purpose, we've never actually thought about that. We've got a strategy. We think that's the same thing. It's really not. And Guy says, an ongoing concern is that those who think they are system leaders very rarely have this awareness or follow these ways of working. Yes and no. I think I would say there are some people at senior level who absolutely follow these ways of working, but people can have a vested interest in not doing so, and fear can take over. I think the thing to do is to see it almost inverted, Guy, so that you're taking the lead here and they will eventually follow you. We could have longer conversations on any of these, and I really look forward to reading the chat in more detail. However, I am very conscious of time, and I want to give Ruth adequate time as well. So thank you all very much for this. I'm going to hand back to Helen now, who's going to introduce Ruth. Thank you.
Thanks, Debbie. That's absolutely fascinating and clearly resonating with lots of people on the call, all of us, I think. I should say to colleagues, we will share these slides with you after the event, so don't be frantically taking screenshots of all the slides. We'll give you a decent set at the end of this, because there's some really practical tips in there, and some real food for thought. So yeah, really important stuff. And along with the slides, don't forget we are recording this, so if you want to go back and hear Debbie's words of wisdom, and Ruth and Esther's words of wisdom, the program will be recorded, and that's really helpful, especially when you're reflecting back on things. So Moving on, without further ado, I would like to introduce the next speaker, which is Dr. Ruth Hussey. Many of us have worked with Ruth for many years. Some of you might not know her. So Ruth's currently a non-exec director with the NHS ICB, Integrated Care Board for Cheshire and Merseyside. Ruth's also governor at the Health Foundation, a trustee at the Reader Charity, and has a range of advisory roles, including for the National Institute of Health Research and Social Care Inspectorate in Wales. So Ruth's going to describe some of her public health experience and work, drawing on examples from when she's worked in Liverpool, the North West, Whitehall, and as I mentioned earlier, Chief Medical Officer for Wales, to just inform a bit of today's session around the reality of working in these complex systems. So without further ado, I would like to hand over to Ruth, please. Thank you.
Thank you, Helen, and good morning, everyone. I'm really pleased to be here. I've been asked to sort of talk about an example and maybe draw out some top tips. Interestingly, although Debbie and I worked on this separately, there'll be a lot of resonance in what I say in my top tip section. So perhaps you could start the presentation. Move the first slide, please. So, as I say, example. So, question, is the issue that you're grappling with, is it a large-scale change? Is it something that really is quite fundamental? It's not a project in a constrained way. So these are two useful questions to ask yourself. Is it something I really want to make a complete change in something? It's going to look really different in 5 years from now. You can think of current examples like neighbourhood health models. It's a concept. But there'll be things that you want to do, and it'll involve changing processes, structures, behaviours in a system. So think about your example in that context. Is it something that requires that way of working? Next slide, please. So the example I want to describe very briefly, I haven't got long, is how we came together as a group of public health directors in the Northwest to turn the narrative about health inequalities from deficits to assets. And I'll explain a bit more about that. Next slide. The context of this, and it's an old example, I'll refer to some other ones that, in my top tips, but this example grew out of late 2009, 10. We got a group of public health directors across the Northwest together. It wasn't the whole 24, but it was a subset. And we sat down and thought about how are we framing public health? How are we talking about public health and drawing interest in it? So we talked about the new public health, did a little video about it, but this was the basis of it, that we wanted to talk about wellness and tell the story about how wellness connected with the social determinants of health. So this was the sort of concept we were working with at the time. Next slide, please. At the same time, Michael Marmot produced his work on health inequalities. Obviously, it was a huge opportunity in the system. So we took the Marmot report and we held an open space event. Over 200 members of the public and professionals came together. And we talked about, how are we going to really make a difference here? How are we going to really build on community assets in the way that we think about these things? And you'll see the word map there of the sort of thing, the phrases that came out. So we sort of ended up with something called Living Well Across All Local Communities. And we did a little booklet, that's the front cover of the booklet, and set out some directional statements. Next slide, please. So this wasn't a hard, target driven sort of thing. This was a call to action on a new direction, that it's time that we looked at our communities and the way we work with communities in a different way. And I haven't got time to go through all the detail. You'll get the slides afterwards. But underpinning it with the Marmot concepts of it's about people, places and power in particular, and how we share power to create these opportunities. Next slide, please. And so in the booklet, we talked about what was necessary to enable us to shift towards this living well approach. And these are some of the things that we said were the key components of this living well approach that we were trying to use to, if you like, drive the way we thought about the next phase of public health. Next slide, please. Then we got serious about, so if we were all living well, what would everybody be doing? can we describe what we're asking people to do? So we used a driver diagram, which, as you know, is used widely in healthcare improvement. The print's very small, but there are 5 small boxes. We said, well, what would businesses be doing differently? What services would we be providing? What would staff be doing differently? What would communities expect and contribute? And what would individuals what would their part be in this change process? So it helped us then focus down on the components of what a system shift like this would entail. So that was helped us guide us, if you like, about what we needed to do. Next slide, please. So we started off, and we were working across the Northwest. So we sort of said, right, we need a call to action. We need to draw interest in this issue. We need to sort of tell the story about why this matters. So we talked about living well in the Northwest, what I can do, what you can do, what we can do together. And the sort of passionate plea was, we need to leave the Northwest in a better state than we found it. Now, you can pick whatever you want, but it galvanized us. There was a sort of legacy feel to that ambition, and we used the current, unsurprisingly maybe, some of the things that we used to say create urgency are still very relevant today. Next slide, please. We then tried to distill that purpose into a clear message, and this is what we came up with. We want to shift from illness to wellness, and underpinning this is the I in illness to we in wellness, that it needs to be created together, because we all influence each other's well-being. And so that became, we want to shift from illness to wellness was a sort of underpinning mantra that we had. Interestingly, it sort of resonates with where we are today, with the shift from treatment to prevention. And it may be you want to revisit some of this work and actually think about, how do we capture it in an energizing way to engage all the different sectors of society that we want to engage. So we use that simple message. That's first thing, clarity of purpose and communicating it. Next slide, please. The other thing that's important in large scale change of this way is data. You need information to stimulate interest or to guide you in what you're going to do. So for the first time ever, we did a Northwest Regional Wellbeing Survey, never been done before. And we did it in a way that gave the data to local areas to use for themselves and to create conversations at local level. And it created a lot of interest. And so that's another way in which you can stimulate the idea and get people talking about it, which is what you're trying to do. Next slide, please. The other way that we used, Liverpool had in its capital culture years that followed, in 2010 they'd had a year of health and wellbeing. So we as a group said, well, why don't we have a Northwest year of health and wellbeing in 2011? And it can encourage individuals, it can encourage organisations, it can draw interest in, oh, I want to be part of that. So what does it mean? How can I contribute? So using symbolic things, using data, using clear messages, all sorts of ways. It's all about how do you draw interest into what you're doing and get people to contribute in lots of different ways. Next slide, please. So this is the underpinning theory model. If you start on the top left, the first thing is, what's the need for change? What are we trying to do? Be clear about that. And then if you move to the middle, where it's got the circle around it, you start framing the ideas and then talk to people, and then you sort of reframe it because actually they hear it differently or have a different perception. So it's a constant iterative way of working. So then you make some changes and then test it and see, is it working? No, let's course correct, or let's conceptualize it in a slightly different way, or tailor it to that audience because they understand it in a different way. And you go round and round and round that circle many times. It's not a project plan and it's not program planning. This is emergent planning, if you like. What are the outcomes? Well, on the right hand side, you could get sustainable change. You could get a plateau. This idea is run out of steam. It's just, we can't reframe it anymore. We need to move on and think of something else to do. Or you can run out of energy. Or as in the case of my group of directors of public health and myself, we were reorganised, very topical, because by 2012 we'd all dispersed into different roles. And interestingly, I think all of us took some of this ambition into our subsequent roles. But this is what happens, but it may come around again in a different guise. I'll leave it to you to judge whether the narrative did successfully move from illness to wellness, or whether we ran out of steam and plateaued. Anyway, that's my example. I say I've got, it's relevant because it was in the Northwest, which is why I picked this one. But also, not everything works out in the way that you want it to. Next slide, please. So very briefly now, I'm going to do 2 slides of top tips. And this repeats some of what I've said and what Debbie said. So first, purpose, clear issue, absolutely key. So you can communicate it, and so other people can communicate it for you, so they get it, and it doesn't get lost in interpretation. And that can be a narrative purpose, like living well in the Northwest, from illness to wellness, or it can be a real tangible, measurable goal. An example, we did a large-scale change thing on reducing alcohol admissions to hospital, and that was really measurable, tangible, data-driven outcome that we wanted. So you can do lots of different ways of doing this, depends on the issue. The second point, coalition of the willing, and I know this phrase is being used quite a lot in political circles at the moment. It comes from Cotter. It's one of his 8 steps of creating change, and what I did in Wales when we were introducing something called value-based healthcare, I actually had a coalition of 5 people, colleagues from different walks, coalitions, and the 5 of us would get together 5 o'clock in the evening once every 3 or 4 weeks, and we would just brainstorm, think about what we wanted to do, and then go out and do stuff, and then come back and report on what we were hearing, what we were doing. So it was not a formal committee, it was not a job description, it was us getting together to say, how are we going to do this, and bring back information and actions that we've done and share them. So that's one way we did it. In the alcohol project that we did, or change program we did, there were 5 of us, and we met for about half an hour, sometimes on the phone, sometimes in person, every week, just check back and say, what have you done this week? What are you hearing? What do we need to do next? And take responsibility for going away and doing that action yourself. So lots of different ways in which we can open this, but it's not a committee. Understand what draws people in, what's motivating people, what energizes people to get involved with you, because it's about discretionary effort. Use multiple methods. It's about the data. So when, again, looking at the alcohol one we did, we presented data which said every 4 seconds somebody is being admitted to hospital with alcohol related harm in this region today, creating that feel. It's about feelings, isn't it? So it's using data to appeal to the heart and the head. So think about how you're influencing. Framework, not rules. Debbie talked about rules. This is not one way of doing things. This is about a concept or an idea or a system change you want to do, but it's not predetermined how it's actually going to pan out. So set out some sort of framework. In the Living Well example, we actually set out what would it look like in 1 year, 3 years and 5 years? What would the system be doing that we can check back on? And so we had, what we call indicators of progress, and it would be about behaviours in the system if we were having an impact. Don't drown in governance. Debbie has said the same thing. This is not, as I say, formal governance-led sort of, or grounded sort of work. It has to be more emergent than that. Give it away, and this sounds a bit odd. You say, well, it's my project, it's my ambition. This is mine. It won't work if you go at it with, I need to control it. It's my project. It's my issue. It's my change program. It's about giving it away to other people, empowering other people to do stuff that contributes to that wider goal. So framing everything you do in, how do I give it to other people to run with this agenda? And then how do I support and celebrate what's been achieved by other people and value that? And then the final slide, a few more top tips, and then I'll finish. Leader and a follower. You can't do everything. Follow other people. Consciously do that. And that point that Debbie made about building relationships, respectful, supportive, encourage each other. The biggest thing with this sort of change program is maintaining energy, not being, put off by setbacks, but actually re-energizing yourself. And that part of that is not always feeling that you are the leader. Find agreement and disagreement. This is where you get the framing and reframing. Sometimes we sort of listen to the people who agree with us, and if you think, oh yeah, it's going really well, and it's uncomfortable when people don't agree with you, and sort of undermine what you're saying. That's a real nugget. An example would be when we did value-based healthcare in Wales. I'd present to clinicians, and some would get it and be really interested. Others would say, because we were saying, doing everything possible for somebody isn't always the right answer for that person. It's about co-producing shared decision making, that maybe you don't do the intervention that you can do because that's your job. And we'd get clinicians saying, but they'll sue me, they'll complain because I didn't do everything I could possibly do. But once we'd heard that message, we were then able to sort of frame the materials in a way that and address some of those underlying fears that were coming back. So find the disagreement. And then finally, sort of being yourself, being open about what matters to you, your values. Increasingly, people want to know what's in it for you. What's driving you? What do you represent? And so being open about some of those is really important. And then what you say, it's amazed me over years of working in public health that people come back to me and say, I remember when you said X. It terrifies me at times because some of these things come back to me and they're 20 years ago, but things stay with people. So what you say is so important. And I used to talk about, when I was regional director in the Northwest, create a climate of expectation. What you talk about, what you expect, be explicit about those is a way of trying to get other people to come along on the journey that you're trying to create. And then finally, and the bit where we sort of got challenged was, how do you make it sustainable? And that's the hardest bit of that cycle. How do you get to a point when you've either plateaued and it's sustainable and it's good enough, or how do you re-energize and make sure it's embedded in systems and processes? And as Debbie said, finally, this is not something you do in a year necessarily, but it's important to have milestones on the way to say, are we getting somewhere? What do we need to do slightly differently next time round? And that's where the 30, 60, 90-day cycles help you to just check back all the time as whether we need to do something a bit different because it hasn't landed. I probably had way too much time. That's it in a rapid run through. I hope that's helpful, and thank you for inviting me to come today.
Thanks, Ruth. That was absolutely fascinating, and I remember the work going on. So, it's really helpful to have some practical examples. I'm going to move into the second session this morning, and we're handing straight back over to Debbie again. So over to you, Debbie.
Thanks very much, Helen. I wanted to use the last part of my bit this morning really to talk about how you influence within a system. If I could have the next slide, please. Thank you. Just before I start, I wanted to refer back to what Ruth was talking about and maybe relate some of this to her words. I was particularly taken with the idea of what you say matters. Never underestimate the power of what you do. So 3 years ago, I did a systems leadership programme for an active partnership in North Yorkshire Sport. And I wasn't expecting this, but just towards the end of last year, the person who had originally commissioned the programme, the director there, posted something. This was on LinkedIn, and he said, we're still using these ways of working even now. So never underestimate the power of what you say and what you do to have lasting effects, and that can be after you've moved on, whether you think things have plateaued or not. Never underestimate this. And because even what can feel like a plateauing is still progress. It's still progress in a place. And I just wanted to flag up large-scale change. And shout out to the Academy of Large Scale Change, because I was part of the Academy of Large Scale Change back in the day. And on the NHS England website, somewhere, there is a guide, a written guide to large scale change. I think the last version was something like 2017, 2018. It should be still there. What happens to it once NHS England goes, who knows? So I really think it's worth downloading if you can find it. I will try and find the link as well and send it to Helen and Tracy so that it can be included with the slides. But there's a lot of really good stuff in there, and it's still absolutely pertinent. And Ruth talked about power. Quite often, and I suspect I'm not going to do it now, but if I did a kind of straw poll and asked people what they meant by power, they would see it as the power that derives solely from position and seniority. So about legitimate power, the idea that because you're elected to a particular role or you've been appointed to a particular role, that is the only place your power derives from. And it can be about coercion, it can be about giving reward or withholding reward, and it's purely seen in those terms. But what I want to get across in this session is that there are different forms of power. There's the power that you have through your own connections and networks. There's the personal power that you have through your own expertise and knowledge. There's the kind of social and cultural power that you have through your understanding of difference and of your understanding of what it means not to just follow the herd. There is political power as well, and I don't mean just large P political power, knowing how the system works, how things get on agendas, how you actually get your voice heard. And as part of that, influence is a power in its own right and is greater sometimes than the formal positional power. And by way of example, again, this is not particularly local, but I think it is pertinent. So if you remember, a couple of years ago, Gary Lineker said something on what's then, I think, still Twitter, about government approaches to asylum, and he likened it to Germany in the 1930s. Now, Gary Lineker, not a BBC employee, but engaged on a contract. Tim Davie, Director General of the BBC, promptly suspended Gary Lineker. So Tim Davie, in this example, is the person with the formal power. You know, he's Director General, he is earning all the money, he has all these people reporting to him. But Gary Lineker had the influence. He could influence Alan Shearer and Ian Wright not to appear on Match of the Day, and they could in turn could influence others not to go out to various matches, not to commentate, not to do the camera work. And as a result, you had this out-of-body experience Match of the Day. I don't know if any of you ever saw it at the time, but they didn't have the theme tune. They just had random clips of matches with no commentary. And Tim Davie, ultimately, man with all the formal power, had to climb down. And the guidelines that were subsequently adopted were very much as Gary Lineker had suggested. So never underestimate the power of your influence and what you bring to the party. You've got the information, you've got the relationships, you know the lie of the land, you've got the credibility and the authenticity that comes from your roles and your knowledge. So always see your ability to influence as being absolutely there. So first things first, if we could have the next slide, please. Who is it that you actually want to influence? And get very, very specific here, to the point of names, named people. And if you don't know who they are, well, great, that's data. At least you don't know, at least you know where to start. But get very, very specific here. And there are various ways in which you can actually prioritise here. You can prioritise as this way of working on the left shows. This is a form of stakeholder mapping by people who have, I've said here, high power, but what I really mean is kind of clout. in the system, influence one way or another. The people who have power and who support you are the people to go to first of all, the people in that top right quadrant. For the people in the top left-hand side quadrant, can you move them across by informing them, by building relationships, by working with them? So worth mapping out who your stakeholders are and who's in the top right and top left particularly. Or another way of looking at it is by using something called actor mapping. This is from community organising in the US. And there you're looking in the first instance at who shares your values. Who shares your values? Who sees the world? You know, you will know this instinctively in the same way that you do. They may be in competition with you sometimes for money, for contracts, for other resources, but basically you are all on the same side. And they can form a broader constituency. They can sometimes take leadership from you, so it doesn't all depend on you. And know who opposes your values as well. These may well be people in your own organisation. Never ever start with people who oppose your values, okay? You will be banging your head against a brick wall. Helen Bevan, formerly of NHS Horizons, had a lovely saying, it's a Native American saying, if your horse is dead, get off it. You know, with people who oppose your values, often that horse is just dead. No amount of defibrillation is going to change it. You are banging your head against a brick wall. What I'm saying is choose your battles. Start with the people who share your values or who support you and have clout to do something in the system. And think about different ways of influencing as well. If I could have the next slide, please. Hannah earlier was asking, how do you influence in an online world? How do you build relationships in an online world? In an online world, it's very easy to see relationships and influence as in these left-hand side boxes here around we assert, we persuade. The way we work is by sending other people emails or by writing reports and business cases and proposals and circulating them. So we use logic, we use facts, we use data, we use debate. And we think just because we do that, that is the same as influencing people. That's push influencing. As well as pushing, you also want to pull. You want to find common ground. You want people pulling for you. So you are not having to make all the effort to push, because it can be absolutely knackering, and there can be very cynical and Machiavellian people out there who will keep you on that particular hamster wheel. You know, if you just write another report, somehow things will turn out to be right, and somehow they never quite do. So see influence as much as you're pushing through your business cases, through using data, through using evidence, as trying to bridge with people, trying to make those connections by saying sometimes we don't know about this, actually we could do with some help here. Can you actually find common ground? This again is where shared purpose comes in so handy. So don't get caught up in, can you just do one more report? But think about pulling as much as pushing when you're thinking about influence. But you can shift perspectives in order to change what people think. And you do this by thinking about how you reframe how people think. Frames are how we see other people, other individuals, other sectors, other organisations, other departments. If you've ever had a meeting and you think, oh God, these people are just the blockers here, oh, I just feel so depressed about this, that is a frame that you are using. So it's about how public health sees other parts of local government or the NHS, and vice versa. How the NHS sees local government, sees national government. how different parts of an organisation view each other. And these are mental shortcuts that we all use. They are nothing to do with intelligence. They are nothing to do with education. They're nothing even to do with consciousness. And they can be really, really strong because we take them with us wherever we go. We don't even need to think about them. And if you want change, you can go into a room for a meeting with evidence a mile high. If the people on the other side of the table have frames that don't align with yours, they will find a way to discount your evidence and they will double down on their frames. And it is the weirdest thing, but they absolutely do. And if you want to see this in action, then over on the left hand side of the screen, I give you the post office. This was from last year. It was in the Sunday Times, an interview with the former chair, Henry Staunton. And he said that the post office was still shaped by this toxic culture, and they still believed that even after Mr. Bates versus the post office, after a huge court case, after gasquillions of different articles in mainstream and trade press, they were still wedded to their frame of people digging into the tills. So it shows you just how strong frames are. But the great thing is they are not immutable. And if you can change the frame, the way people see things, colleagues, communities, counsellors, people on health and wellbeing boards, people in VCSE organisations, then you can change how they think. You can change then what they do and what happens on the ground. And I want to give an example of this from a council perspective, please. So if I could have the next slide. Thank you. This is about homelessness and is a tale of two councils. So, Bournemouth Council, okay, 2019, their frame for homelessness was it's a public nuisance. And it had practical consequences, bars on benches. Someone from Bournemouth told me they played loud music in the bus station overnight. So to dissuade rough sleepers, absolutely. But it was because that was their frame. Worthing Council, about 100 miles down the coast, same political makeup of the council. Over time, through public health people, through homelessness charities, through the NHS, through VCSE organisations, working together, working in partnership with that shared purpose, the council changed its view of homelessness away from public nuisance and towards homelessness being a public health issue. And because of that, every councillor with responsibility for planning voted for what had been a nurses' home to become a hostel for homeless people. And Conservative MPs like Tim Latton defended it in the Commons. So this is not fluffy stuff. It has real practical consequences and is a real tool in your armoury. So how do you do it? Well, if we can have the next slide, please. Thank you. So you retaliate first. This is a kind of a Northwest reference because this was said by Tommy Docherty back in the day. He was asked, what will you do if the opposition retaliates? And he said, we'll retaliate first. This is about you retaliating first. It is about you deciding what you want the argument to be, what you want the frame to be. So do you want the frame, for example, around homelessness to be about public health rather than public nuisance? What's the frame you want to use? And again, if you've got a shared purpose, it's much easier to do that. And once you've got it, you are absolutely relentless about promulgating it. You don't barrel it down people's throats, but you just keep on keeping on. You don't get distracted by denial, acknowledge that there's different ways of seeing things, and then you go back to just changing the mood music by keeping the focus on what it is you want the focus to be kept on. And it doesn't all need to be you. It can be people, other people in the system who have the trust of others and can therefore deliver messages for you. might be a district nurse, might be somebody in a community, might be a counsellor. Who are the messengers who can help deliver those messages for you? And if you think back, I'm just using Strictly here as an example, again, not strictly from the Northwest, but even so, last summer, remember they had that huge scandal with some of the professionals sort of kicking out at some of the dancers, some of the celebrities. That was the frame then. What did Strictly do once it started? That just disappeared. Frame relentlessly on sequins and lighting and the journey and everything else. Just did not get mentioned. That is an example of reframing in action. And it's a key part of how you influence other people. So just think about the frames in play. What frames are you using? What frames are you seeing? How do you want to be seen? What's your story? What's the territory you want the argument to be on? And who are your messengers? And who do you really want to go after in terms of influencing? And can you get them to pull as much as push? But influencing, when you're working with complex issues, when you're working with adaptive leadership, is one of your superpowers. So please use it. I'm going to finish there. And I'm going to hand back now to Helen, who is going to introduce Esther, and we're going to talk a little bit about this in action. So thank you.
Thanks, Debbie. So as Debbie says, we're going to bring Esther into the conversation now. Esther is the Public Health Programme Officer at Knowsley Council. She's been in the team since 2021. She works on the wider determinants of health and reducing health inequalities. Esther completed her UK Public Health Registered Practitioner Scheme in 2023 and in October won the National Award for Collaborative Working in recognition of the work she's done on healthy advertising across Cheshire and Merseyside. So Esther, well versed in system leadership across the 9 authorities, so handing over to you. Thanks.
Thank you very much, Helen. Thank you. So thanks for inviting me. I do feel very honoured to be presenting alongside Debbie and Ruth today. I hope I can do this justice. So I'm going to talk through very quickly about a piece of work that I've been leading on since around 2021, which was around healthy outdoor advertising. So if you just go on to the next slide. Then there's just a lovely example of the sorts of things that we are working to try and avoid there. And then the next slide again, please. So just a bit of background for anyone who doesn't know what this is about, who's not been involved in this locally. So this was a commitment to adopt and implement healthier advertising policies on council-owned sites across the whole of Cheshire and Merseyside. So in the first instance, this has generally related to food and non-alcoholic drink that's high in fat, salt or sugar. But a couple of us now are looking to try and expand those policies further to include some of the other health harming products that we don't want to see on our advertising sites. So I'm really, really pleased to be able to say that we currently have 8 out of our 9 local authorities with this policy in place and fully adopted. And the final one, we're really hoping and supporting them to do that over the next couple of months. We're hoping we get there. We're also working with the Liverpool City Region Combined Authority, looking about how they could adopt a similar policy, given that the Metro Mayor, he committed to this agenda back in 2024. So that middle green box there is his commitment, alongside some other Metro Mayors, to take out some of this advertising on buses and trams and transport networks. So it is quite a big deal because since 2019, since Transport for London did this, numerous authorities across the country have been trying to do the same thing individually. And I think it's less than 30. I may have my figures wrong, but I think it's less than 30 have actually managed it. So of those 30, 8 of them are in Cheshire and Merseyside. No other place in the country has had such a large concentration of authorities with adopted policies. And so by doing that in that way, we've secured this high level of safeguarding for our residents as they move and work around our area. And that is so much bigger than if just one of us had done it on our own. And I just feel this is a real example of the whole being more than the sum of its parts. Because, you know, for the actual outcomes we've had and the influence of the people who've been involved in this, it just wouldn't have happened if we'd all been trying to do this separately. So the formal adoption started with Knowsley in January 2024, but I would say that the work to do this and the conversations to get to this point probably started 18 months, maybe even 2 years before that. And it just stemmed from a little idea that I had to get this type of policy applied to our transport network across Merseyside initially, like it had been done on the Transport for London network. But I was just sort of sitting in my desk in Knowsley thinking, well, how on earth can I get anything to that point on my own? I have no authority in public health in Merseyside. I have absolutely no authority over the transport network. So that to me just seemed like a fairly large stumbling block. And I have to say at that point when I first thought about it, I just thought I don't even know how we can start to move forward with that. So if we just go on to the next slide, please. I really did not at that point start out thinking, oh, I know, I'll do a piece of system leadership. What skills do I need to do that? What do I need to find in others? Who else shall I speak to? Debbie's given us a great overview of what system leadership is, and I'm certainly not professing to be any kind of expert. However, I have got a little smile on my face because listening to Debbie and Ruth, I thought, I'm ticking some of my things off here, so I feel like I might have actually done this right, so that's good. So what I'm just going to do is take you through some of the steps that I've taken locally and look at some of the reflection that I've done as well, which kind of helps me understand what some of the challenges and enablers have been to get us to this point. Next slide, please. Sorry, Tracy, there's a bit of clicking on this. I'll tell you when to click. Oh, you've spoilt it now. Don't worry, it's fine. It's fine, don't worry. So first of all, there's just me. Could this be a possibility? Why, if we've done it in London, why couldn't we do it here? And then you can click again now. Then I spoke to James from Liverpool, James Woolgart, who I'd seen presenting on a healthy weight webinar. So I just sent him an email, never spoken to him before, just sent him an email and just said, what do you think about this? Do you think this is something we could do together? And he wanted to do that, had it been on his radar for a while, but just put to the side a little bit while he dealt with COVID. And then we made contact with Sustain, who are a Food Alliance company, and they are the ones who supported Transport for London and have gone on since to support other authorities with their policies. Just click twice now, Tracy, it's fine. So they were really keen. So there were then 3 of us thinking about how we could do this together and what the best approach would be. And it really didn't take very long before all of the 9 local authorities had come together and said, yes, we want to do this together. And now we have a working group and it's much wider than just our local authorities. So we have representations from CHAMPS. We have all the directors of public health involved, not necessarily sitting on the working group, but all involved in this and championing this. We've got representative from the Liverpool City Region Combined Authority, from the Health Equalities Group, from the University of Liverpool as well, who are going to help us do some evaluation, and everybody just playing their individual and joint parts in that smaller system. We meet about every 2 months. I just call it a self-help group for advertising. There's no set structure to it. There's no governance around it. We don't have any terms of reference. I just send out what's been relevant in terms of notes after the meeting. And that's about it. And between those meetings, if we need help and support, we just email each other in between. So again, it's just where that whole is greater than the sum of its parts, because each one of us on our own wouldn't have been able to make as much noise about this. And in some of those areas where it has been more of a challenge, it wouldn't have had the same impact to do those negotiations to get the policies adopted. But by having that varied membership in the group and tentacles reaching out to some others more senior voices, we've just secured a much greater impact and interest in that as well. And at this point, I do need to thank other people who've been involved for their commitment and their support, because it really hasn't just been me doing this on my own. Okay, next slide, please. So this is just me kind of thinking through, okay, so what have been some of the enablers that have got us to this point, and what have been some of the challenges? I think the first one really is around the Transport for London valuation. That's what made me start thinking about whether we could do it here. That provided us with an independent baseline. It then meant we had availability to find other resources and data and research papers that supported our argument. And we reached out to others to understand what evidence they could get hold of and what they knew of as well. And that meant we could present a really rounded view. So it demonstrated the growing body of evidence and ethical support for this type of policy. And then we tied it into other key pieces of work. So we tied it into our local authority healthy weight declarations. We tied it into the Cancer Alliance obesity project that's happening across Cheshire and Merseyside. So we were able to present that argument from lots of different perspectives. And as I've said, the support of others was instrumental, and it wasn't just me being a lone voice at all. We secured buy-in from lots of different people of all levels, of all different structures, and that was externally to councils as well as internally. And it wasn't just support for me or from me, but members of our group have supported each other and used their own experiences and networks also to offer solutions to other people in the group. So in terms of the challenges, I needed that support because I didn't understand, and I still don't understand, the full complexities of the system we work in terms of public health and the NHS and advertising and local authorities. I didn't know who I needed to speak to, but once we had that evidence base, we had buy-in from my peers across other public health teams, I could pretty much hand that evidence over to those people, and they could then lead those conversations in the places that I couldn't reach or I had no clout in. And I've put being the expert, but so one of Debbie's first slides said that the starting point was to understand what you are dealing with. And I did not know that at the starting point. I don't think the first few months and the first conversations that I had, and maybe not even now, really understand that point and all of the complexities around that. I don't know much about advertising rules. I don't know much about contracts or council revenues, but I've just learned the things I needed to know as I've gone along. I've just found opportunities to ask the right questions at the right time of the right people and try and build that picture together and understand which bits do we need to know to get this done. Thinking about the right resources, again, this has been mentioned already, but it's not always about writing a formal report with lots of data. Sometimes we just needed an informal, off-the-record conversation. Sometimes it was about sending like an email nudge or a little reminder to somebody, an offer of support if someone else was struggling. We've got lots of resources across Cheshire and Merseyside. We're very lucky. We've got lots of great people as well as our data and our evidence, but it is about using those right tools at the right time. That's what I found really useful in terms of getting this policy as far as we can. But the framing is also that challenge, because it's important to get the right message so it lands effectively with the person you're talking to, and you grab their interest rather than making them turn away and move on to their next piece of work. So in some circumstances it was about framing it as childhood weight issues. Sometimes it was about poverty. Other times it might have been about climate change. Other times it was finances and revenue, ethics and morals. So, finding the best method, finding the best words to influence that person you're trying to engage with. And going back to my initial thought process and how I could move forward with no authority across that system, it was just those small steps to build a group of like-minded people who were willing to come along, to spend a bit of time and create that collective authority for us, and then using that right level of authority at the right time. So it would have been no good me trying to pick up the phone or emailing the Metro Mayor and saying, oh, have you thought about advertising policies? It probably wouldn't have got read, or the phone call wouldn't have been answered. But between our group, there were people who could make that phone call or could send that email, or they knew the people who could. And that's how we got up to those right places. It wasn't about everything having my name on it at all. So on reflection, it has been a massive piece of learning for me. Definitely times when I wondered if it would happen, if it would be worth it, whether we would get to this point. Amazing that we have. And I have to say there's sometimes when I probably even regretted starting out on the path and opening my mouth in the first place. But it is amazing where we've got to now. And I think it just shows that, sometimes taking that initiative, having that very first conversation with James from Liverpool that started it all off, started those ripples. And even though even at that point the goal just seemed massively out of reach and sometimes even impossible, we can in fact just end up changing that tide and making a difference. And that's all I'm going to say. So thank you very much for having me today.
Thanks, Esther. That's fascinating. And of course, have been involved in this from my own local authority point of view. Had massive impact in terms of rolling that out across the patch, and we're just really grateful that you started off for all the work. I think you've done yourself down a bit at times in that presentation. Actually, you should take some credit, because you've just done a massive piece of work and you should take a bow. You've really changed the system going forward, and we've just got one local authority to box off, and then that's a massive achievement, and as you say, hasn't happened anywhere else in the world, in in England, sorry, in the world. Got my global head on this morning. So in the interest of time, I'm going to move swiftly on to the next session, where we're going to put you into breakout rooms, and Debbie will take us through what we're going to do next. So I'll hand back to Debbie.
Thank you, Helen. We were very aware that we'd done a lot of talking during the session, and we wanted to give you some possibility of just reflecting in small breakout groups what's resonated for us, and what one thing, small thing, are we going to do? Whether it's, I'm going to look at the slides again, I'm going to go for a coffee with somebody, I'm going to do something, because the great thing about that, I think, that Esther demonstrated is that you don't need to have everything done at the start. Just take action, do something, use messengers, know what it is you want to do, and you can absolutely go much further sometimes than you might imagine.
So welcome back, everyone. I do hope you found that helpful, made some connections, probably some people you knew already and maybe some people you didn't. What would be really helpful in closing the session is if you could please complete the evaluation form, which should drop into the chat if it's not already there. So keep an eye out for that. But also, if you feel able and comfortable to do so, sharing in the chat what's the one thing that you're going to do today following this session. So you talked about that in our little breakout rooms. Debbie talked about going for a coffee with someone or doing something else. Just doesn't have to change the world. That's not what it's about. It's about one first small step that you want to take in this journey. So just by way of closing, I'd just like to thank you all, colleagues, for attending this morning. I hope you've enjoyed it. Hope you found the session beneficial as a first step in introducing the concept, and some core skills lead to system leadership. I have to say I've been involved in system leadership for probably about 15-20 years, and I'm still learning. So if it feels a bit abstract or strange or weird, keep with it, because it does fall into place eventually, and we're all learning as we go along and sharing our learning as we go. So we will be sharing the recording and the PowerPoint slides with you after the session, and obviously don't forget to keep engaged with other CPD opportunities via our newsletter, Collaborate, which I suggested you sign up for at the beginning of the session. It is a really helpful newsletter, and lots of links and things in there about networking and stuff like that, so it is well worth signing up for that. It's open to anyone. I'd just like to close at the end by thanking you, dear colleagues, delegates, for attending this morning. I hope you enjoyed it. And also to our fantastic speakers, Debbie, Ruth and Esther, who I think have provided a real flavour of what systems leadership is about. And as I said, this is the first in a session of system leadership sessions. So we'll be continuing the conversation later down the line. So unless there is any other comments that people want to actually verbalise before we leave, there's lots of things going into the chat, which we're going to summarise anyway. I think there's a lot in the chat as much as there was in the presentations and the discussion. Just want to say thanks, everyone, for all your input, all your support, and have a great weekend when you get to it. Thanks. Bye now.